Hi, my name is Dr. Shiralee Poed. I'm a senior lecturer at the University of Melbourne in the Melbourne Graduate School of Education, and I work in an area called Learning Intervention, which is a program designed to help teachers who are working with children who aren't responding to either behavioural or learning strategies that the teachers are using, and they're trying to upskill so that they've got a little bit more in their toolkit to support learners. The advice would vary depending on the school, and the advice is so much easier to give in schools where positive behaviour for learning is being implemented, because schools that are trained in PBL have an understanding of the three-tiered intervention logic that exists. And so conversations with those schools are much easier to have, because in some ways the word intervention's become a bit of a dirty word in Australian education. It's politically loaded because it's used in conversations like close the gap, or it has an inference of fixing a problem, which in education is about fixing a kid. But those of us who work in PBL understand that intervention isn't about fixing a kid. It's about understanding the systems and practices in our school, looking at our data so that we can work out what we can do to create environments where all kids can be successful. And so sometimes those interventions actually need to start with our core universal practices, what we do in our classroom, the evidence-based practices that we use, the way we set up our classrooms and our environment, the climate that we create, the relationships that we build with kids. All of those can be interventions. Dr. George Sagai talks about this wonderful analogy, which I use quite often when I'm training. Most people in life become successful adults waking up every morning, setting an alarm clock. But for some people, that's not an effective intervention, and they need a second alarm, one that's you need to get up, and then that one is no, you really need to get up. And then for other people, they might ask their partner to also set an alarm because they're concerned that those two first interventions won't be enough. And we change the interventions depending on what we're doing. So if we're going to the airport and we don't normally do that of a morning, we might then bring in that third tier intervention that day because we need it at that time. If in our schools we treated kids like alarm clocks, that every child had to be phoned each morning to wake them, that would be really expensive for a system to do. But if we can work out what are the interventions that we can put in place that allow most kids to be successful, like an alarm clock, then we can run our schools more effectively and more efficiently. We know in Australia about 14% of kids currently have had some diagnosis of a mental health issue. If we treat those kids individually, if we intervene individually, that's a really expensive model. We would need counsellors on the ground at levels that we don't currently provide. But if we look at ways that we can reduce anxiety, if we look at ways that we can build connectedness, if we look at how we can reduce bullying, if we look at how we can help kids feel successful at school, then we don't need to respond with second and third tier interventions for every child. We know that second and third tier interventions are needed. We do need to provide things for groups of kids who struggle. We do need to find interventions that we can use for individual children who need lots of additional supports. But if we get in place solid universal practices, then we cut back on those interventions that are more expensive to run and take a lot more time.